In part 1 of thyroid disorders, I covered the difference between hypo and hyperthyroidism, as well as what you can expect to see symptom-wise. Now in part 2, let's go over the complications. So recap, we know that the thyroid helps regulate the metabolism, and in hypothyroidism, everything is low and slow, as opposed to hyperthyroidism, where everything is high, big, and hot. Now let's cover complications. In hypothyroidism, a complication you want to watch for is called a myxedema coma, and this is a medical emergency. This is when there's a severe deficiency in thyroid hormones. Think everything is extra low and slow, and this is high risk after a thyroidectomy or if the patient suddenly stops taking their thyroid medication. So if everything is extra low and slow, we can expect to see things like hypothermia, bradycardia and hypotension, decreased respiratory rate, and altered mental status. The number one priority is airway, as this can lead to respiratory failure. You want to make sure you have an intubation kit at bedside. In hyperthyroidism, you want to watch for something called a thyroid storm, which is also a medical emergency. This is when a large amount of thyroid hormones are suddenly released at once and is also high risk after a thyroidectomy due to manipulation of the thyroid. When you have lots of thyroid hormone, which makes everything extra high, you'll see hyperthermia, agitation and confusion, tachycardia, and hypertension. And the treatment for this is methimazole and corticosteroids to block synthesis of T3 and T4, as well as beta blockers and antipyretics. Comment below if you found this helpful, and make sure to share with a fellow nursing student.